Hi, I'm David Mack III, and welcome to another edition of the Empowerment Series, Individuals and Families Affected by Sickle Cell Disease. This is being done by the COBRA, Committee on Better Racial Assurance Sickle Cell Anemia Program, and it's one of the series that we do. And again, these series are actually designed for individuals and families affected by sickle cell disease, but it's beneficial for everyone. Everyone. Today, we're going to talk about something that I was hoping we didn't have to go back to, but it seems the climate of where we are right now in our country, we have to go back to it. We have to deal with it. And especially as relates to the African American community, because sickle cell anemia affects individuals primarily in the African American community. Other ethnic groups can be affected, Italian, Greeks, East Indians, etc., but primarily African Americans. But all of us have different chronic diseases, all ethnic groups. So it becomes very, very important, again, that this information is beneficial to all. And what are we going to talk about? What do we need to talk about? What have we talked about before, but we have to go back to? Vaccine hesitancy. We still have individuals that are reluctant to take the vaccine as relates to COVID. And we're at a time right now where we have here in the Charleston area, the state of South Carolina, and around the country, we have more vaccines than people willing to come in and take it. We've reached a point where folks are nervous about taking the vaccine. That should not happen. I urge everyone, you cannot make decisions based on your personal opinion. You want to look at science. You want to look at data. You want to refer to the facts. Dr. Fauci and other physicians and other scientists, we're very blessed to be here in the United States as relates to science. That's very, very important. So a lot has been done to get us to this point in time where we are so much more advanced than other countries as relates to the care that's available. The challenge a lot of times is making sure that care is available to everyone. The Center for Disease Control, put in place to protect public health, to protect the health of all of us. So there is information, there is science, there is data, there are physicians and scientists that have spent time presenting information, getting information to us. We have to use it again. Don't make decisions based on your own personal opinions. Now, people will throw up the Tuskegee, in the African American community, the Tuskegee experiment, and how detrimental that was to black folk at the time. And that's why we're afraid to take the vaccine. Well, let's look at the Tuskegee experiment. The Tuskegee experiment, in essence, was withholding science to blacks that had syphilis, that were given syphilis and withheld health care. This is different in that we have access to it with the same vaccine that's available for folks in the African American community. You have whites, Italian, Greeks, East Indians. Everybody's in the same line to get the same vaccine, which is being pushed and advocated by our scientific community. That's what makes it different from the Tuskegee experiment. One of the big challenges that we've had throughout life is African Americans getting access to care in rural communities, access to care in certain large cities, in the inner city, where a lot of blacks, access to care. That's been the challenge. So let's keep this in mind. Also, do you remember the anti-vaccine movement? It happened in the 90s. There's a doctor by the name of Andrew Wakefield who started this nonsense, for lack of a better word, that vaccines cause autism. And he started a movement as it relates to that. Well, in so many areas, and you do the research yourself, it's been debunked. He's been stripped of any credibility whatsoever. And time after time, legitimate medical entities have said that not only was that information wrong, it was just plain dangerous to not have people, to make a movement to keep people from getting vaccines, to come up with the totally bogus point or assumption, should I say, that the vaccines cause autism. That is not true. It's been proven in many, do the research, check it out yourself. It's been proven many times it's not true. I was born during the 1950s. Why is it that I don't remember anybody in my school or in my neighborhood having polio? It's because they came out with a polio vaccine. It's much different in the 1940s. Polio also was a virus caught by people out and about, spread from person to person, which would affect the spinal cord and cause paralysis. That was polio. A lot of that happened in the 1940s. They actually used the term polio being eradicated because of what? A vaccine. So we want to be able to really, and in the Black community, I've heard people say, well, I don't know, we're going to pray on it. No. We are blessed to live in this time. You talk about being blessed as relates to the science of this time, being what it is, and having so many people, Black folk, in the political community, in ministries, working at the community level, working in science and research, in the medical field, saying to everybody, this is what we have to do. I'm still running to folks that, well, I'm still thinking about it. I'm still thinking about it. And a lot of times, we as Black folk don't think when these fast food industries come out with a new chicken sandwich, we're lined up around the corner to get that chicken sandwich. We don't know what's in it. So please, ma'am, please, sir, I'm asking all of you. They've been saying it in the news, and they started saying it, and I love the term. Plan your vaccination. Whatever you have to do, transportation, blocking out a day, making the calls, it's easier than ever. I remember a couple months ago, people just having a hard time even scheduling an appointment because everybody wanted to get it, and rightfully so. But now we're at a situation where people are not showing up. And I know that, we've had several people vaccinated and what have you, and the numbers have seemed to be going down and what have you. But please, this thing can spike again. And one of the critical aspects is getting enough people vaccinated, you've heard the term before, to create what is called herd mentality, which means that you've got just too many people vaccinated so the disease cannot wreak havoc like it has. I know there's been some cases of blood clots. According to the numbers, somewhere like 6 and about 1.8 million. It's what's in your best interest, what gives you the best chance to do that which you need to do. All of this we have to process. We have to make a decision. We have to be active in doing that which we have to do. So let me end by saying this again. You cannot make decisions based on personal opinion. Don't. Listen to the science. Listen to the facts. Listen to the data. Look at the data and make an informed decision. And the informed decision right now is to get the vaccine. Again, I'm David Mack III, another in the empowerment series of the Committee on Better Racial Assurance, Individuals and Families Affected by Sickle Cell Disease. Thank you. Thanks for watching. We'll see you next time.